A very broad question is, can you do RLE surgery if you have an eye condition? Now, um, one of the not requirements, but we typically want our ideal patient to have healthy eyes. Healthy eyes have, very good potential for seeing, whereas eyes that have some sort of condition may not see as well, and it may have nothing to do with the optical structures of the eye, the lens, the cornea, and a lot of times these are things that are going to affect the cornea, dry eye, for instance, or you have an issue with the retina, and those tend to be the more common reasons where we will tell you, well, you have diagnosis, and it's such and such. But of course, we're gonna talk to you about it, and we'll determine whether it's likely that we can achieve your expectations despite the eye condition. I'll give you an example. So dry eye, as we mentioned, is something where some surgeons, particularly LASIK surgeons, may say, hold on, I don't think this is a good idea. It may worsen your dry eye. RLE and ICL surgery won't necessarily worsen your dry eye, but we can go ahead and do the surgery, but you must know that you have dry eye, and if you don't treat that, your vision will get worse, because dry eye makes your vision really blurry, and it'll fluctuate throughout the day, and there's really nothing that we can do for you for dry eye, except to encourage you to be very you're rigorous with your artificial tears and your dry eye treatments. So if you're very on top of those things, then sure, we can definitely talk about doing RLE or ICL surgery. And it's very there's many dimensions to it. There's not only the compliance of how you handle your dry eye, but also how severe is your dry eye. If it's just mild, then no problem. But if it's very severe and it's secondary to, let's say, an autoimmune disorder, and these glands that produce, the mucins or the oils that you require for optimal surface health of your eyes are gone, then it's probably going to be really challenging for you to keep your eyes optimized and seeing well. And so at that point, then maybe RLE is not really worthwhile to do, because you're going to have a bigger problem. And then other situations, again, on a spectrum of severity, there's glaucoma. Well, glaucoma doesn't really affect your central vision until late stage, but you have to be thinking ahead, right? What's going to happen to you if this does progress really quickly? You invested a lot of money into RLE surgery, but then ultimately you may lose your central vision. And so is it really a worthwhile investment in your eye health? And that's a question that you'd have to answer. And, we definitely need to make you think about that. And if you tell us, well, it's, let's go ahead and do it. If that does happen, I'll deal with it, or you can take out the lenses and put in monofocal lenses, or help me in some other way. And of course, we're always going to be here to help you. And then macular degeneration is another, or amblyopia, or something to do with the central retina, where it might just not be worthwhile to do RLE, because are we really certain we're going to get you out of glasses for everything you do? Are the multifocal lenses going to work well with your eyes? If amblyopia is easier because you always have that one good eye, and the other eye is just, not as good. But so we're as good as our best seeing eye. We don't need two eyes to do everything that, a one-eyed person can do, everything that a two-eyed person can do, right? But in macular degeneration, usually it's both sides and almost equal both sides. And so in those cases, if you don't have a good eye, then you'd have to really think about, how is RLE going to help you? How are these multifocal lenses or premium lenses going to help you? Because again, the bigger issue is not, cataract and lens changes. It's going to be the health of your retina. So these are all questions that we'll bring to your attention if you do visit with us, and we'll kind of steer you towards the best choice for you. And I'm not shy about saying no to surgery. We definitely don't want you to waste your time, because the last thing I want to do is have a patient say, well, I just wasted all this money, and then there's nothing I can say because we can't reverse it, right? We can't restore your eyes after having done RLE surgery to your old lenses, and then so yes, part of my job is to just make sure that we can meet your expectations, and when there are eye conditions, particularly severe ones involved, sometimes it's just not possible to meet some expectations. And then I think it's okay to tell patients that I just don't think it's worth the money, worthwhile, worth the investment. Maybe it's better to wait. It's always a good option to wait to do cataract surgery at a later date, when now maybe the cataract is causing you more vision issues than whatever the other problem is, and then you address the cataract and all of a sudden vision's better. Anyways, I hope that helps. So a lot of it is really understanding your goals, and trying to understand and trying to guide you to and let you know if we can meet your expectations in meeting those goals. Thank you.